So here's a slide I've used with you before. We've shown you that the states across America seeing really unprecedented numbers of cases in many states. If you remember the last version of the United States map that we showed you, the dark blue was a little further east than it is today. I mean, the truth is that the high case numbers, the level of hospital impact that those Midwest and Western states are beginning to see more and more of is knocking on California's doorsteps, and we need to continue to dig in and do what we can to keep that transmission low. We know that although we're the lighter color at the moment, that these numbers are really going up and going up quickly, and that we are truly in the midst of a surge here in California. Next slide. So today's case numbers, 15,329 cases reported today. Remember the last couple of days we've been dealing with typical weekend lows. We know that often this number is a little bit lower on average because the weekend sort of still being picked up. But the fact that it is nearly our highest case number, not quite, but nearly our highest daily case number is continued concern. Our 7-day average now over 12,500. Some good news is we continue to do a lot of testing in California, looking for those cases. 283,819 tests reported. That's a one-day high for us. That 14-day test positivity at 5.6%. And on the next slide, we'll show you how that is comparing to prior days. Next slide, please. So our 7-day test positivity of 5.9, 14-day of 5.6. Really, the point to pick up there is that it's trending upwards. When the 7-day is higher than the 14-day, that means that the shorter term average is higher than the longer term, which tells us that things are generally going up. Not news to any of you, but always important to make the point with the data that we have. If you look closer at the 14-day test positivity, that's the rate that the governor presents on every Monday. You'll see that we've had in 2 weeks a 51% increase in test positivity. So you might say, 3.7%, 5.6%, what's the big difference? For us, it's a major difference. That means that, instead of just a small number of people who get testing positive, that number is going up. And in fact, it's 1.5 times greater than it was just 2 weeks ago. Important statistic because that trend will likely continue upwards. Next slide, please. If you take a closer look at hospitalizations, we often emphasize the case numbers, but really the cases are concerning in part because they really foreshadow what the impact is going to be on our hospitals. I've told you before, we're feeling more and more confident that 12% of today's cases end up hospitalized about 2 to 3 weeks later. So remember, this number, 81.3% increase over the last 14 days, 5,844 Californians in the hospital because of COVID. These are based on case numbers from 2 weeks ago. What was our case number back on November 10th and November 11th? I'll remind you, it was around 7,000 cases, actually just below 7,000 cases reported on that day. So this tells us that we're more than double today, that the pressure on our hospitals will continue. And it's not just on our regular hospital beds, but it's on one of the most precious resources we have in healthcare delivery, an intensive care unit bed. We've seen a 57% increase over the last 14 days, currently just under 1,400 Californians in the intensive care units because of COVID-19. Next slide, please. So hospital systems are stretched. We know that. I talk to hospital system leaders many times a day to hear how things are going on the ground. So this number has some nuance to it, but remember on the 1st of November, just over 2,500 people hospitalized, 708 in the intensive care units, plenty of room. We've prepared for this. Certainly that is still the case. But when you see the numbers more than double in just under 3 weeks, we're concerned.